Everybody ready to go? All right. Good afternoon, everyone. Just would begin off the top before Dr. Morrison and Chief Nurse Dowling give their updates today that tomorrow will mark 9 months since we declared a public state of public health emergency on Prince Edward Island because of COVID-19. There have been many high points and many low points throughout this journey, but at every step of the way, islanders have done their part. Island businesses have innovated to deliver services in different ways. Islanders have listened to and followed the advice of the Chief Public Health Office, and throughout it all, through difficulty, they've remained committed and determined, and that has been extremely helpful. And really somehow throughout all of that difficulty, we've managed to work our way to here, to get through it until here, which is a good sign. The Team PEI approach has worked and is working and will continue to work, provided that we stay united, we stay focused, and we stay committed to seeing this through until the end. And we can see that end. With vaccines arriving in Prince Edward Island today, we are turning an important corner with this pandemic. As our frontline healthcare workers and long-term care workers roll up their sleeves to get their vaccine, that is a very, very important sign and a sign that we are on the road to a better place. Our public health office will continue to work diligently day and night to roll out what really is the largest immunization campaign in our country's history. And as you can appreciate, it is not an easy feat. They have been planning for weeks and months for this day to come. We are ready, we are prepared, and by the end of the day tomorrow, in fact, if all goes well, we will likely have more people vaccinated in our province for COVID-19 than we've had test positive in our province. So that's a good sign. It's a remarkable accomplishment for our province, and it's a milestone that we should celebrate. But while we celebrate, we have to know that work remains. We've seen over the last 8 days the commitment that Islanders have to keeping our province safe. The circuit breaker that was announced on December 6th wasn't an easy announcement for us to make. It was what many might call our first setback since March. It made us worry, it made us all concerned, and by all accounts, though, that circuit breaker has accomplished what we hoped it would do. With upwards of 5,000 Islanders getting tested, our public health office working closely with each and every case to identify all close contacts and ensure they are safe and isolated, with our lab processing a record number of tests, and Islanders really digging in to do their part by limiting their circle of contacts. I think we've had some success, and Dr. Morrison and I are happy to be here today to tell you that we are ready to look at easing restrictions in the province. We can't and we won't snap back to where we were on December 9th quite yet. That would be irresponsible for us. Instead, we will methodically ease these measures in the coming days and work back to where we were 9 days ago in due time. Dr. Morrison will have some general details on easing of restrictions shortly, and we'll be sharing more with all Islanders in the days ahead. And that is, of course, all providing that we remain on this current trajectory that we are on, and that requires the buy-in of all Islanders. And just before I turn it over to Dr. Morrison, I just would like to take a moment and remind everyone that right now in our province, there are 16 Islanders who are recovering from this virus. Thankfully, they are all doing well, but it's not easy for them, and it's not easy for their families. These individuals need our love and support, and I ask that you keep them in our mind and in our thoughts and wish them well in the days ahead. I mean, after all, this is the season of peace and joy and happiness and love, and nobody does that any better than right here in Prince Edward Island. So I would just encourage us to continue to share that. So with that, I will turn it over to Dr. Morrison for her weekly brief.
Thank you, Premier. Good afternoon. I had a call recently, and someone asked me if I would take the time to speak to his 5-year-old little boy. And so he put his son on the phone, and the little boy asked me, "What time is the pandemic going to be over? And how many more sleeps before it is over?" And I responded and said, "Those are really good questions. I'm not sure, but I believe that by the summertime, we will be in a different place." And today, with the arrival of the vaccine, is really one step towards that different place. Today, I'm happy to announce there are no new cases of COVID-19 PEI over the last 3 days. We do have a total of 16 active cases that are all self-isolating at home. And these cases have a total of 110 contacts that are being followed daily. Since the pandemic began, we've had a total of 89 cases of COVID-19, and fortunately, to date, we've had no hospitalizations or deaths related to this virus. However, the situation in Canada continues to escalate. During the past week, there were over 45,000 new cases of COVID-19, an increase from the previous week, and an average of 6,470 new cases each day. Cases in Ontario, Quebec, Manitoba, and Saskatchewan continue to show increases. In the country, there has been an increase in deaths with 743 in the last week. Hospitalizations are up 17%, and ICU admissions are up 18% compared to the previous week. In the US, they have recorded over 17 million cases now and surpassed 300,000 deaths this last week. Masks became mandatory in public places in PEI on November 20th. This decision was made based on the increasing evidence that when worn properly, masks may help reduce the transmission of COVID-19. And while masks are not our first line of defense, they do provide another important layer of protection, especially when combined with other public health measures, including physical distancing and hand hygiene. Very few individuals are unable to wear a mask for medical reasons, but these medical reasons are not always obvious to others. People who are unable to wear a mask do not have to provide proof they are exempt from wearing a mask. Individuals who are unable to wear a mask are encouraged to avoid, as much as possible, crowded places and large gatherings. They should pay extra attention to physical distancing, hand hygiene, and arrange for testing if they develop any symptoms of COVID. Business operators should ensure that every person who's not wearing a mask while on the premises is given a verbal reminder to do so. But businesses are discouraged from refusing entry to individuals who indicate they are unable to wear a mask. Businesses should not request written proof of exemption to the mandatory mask requirement. Islanders, including business owners, are encouraged to be kind and show compassion and understanding towards those who are unable to wear a mask. Last week, Health Canada approved the Pfizer COVID-19 vaccine for use in Canada. This is a 2-dose regimen with a booster shot required 21 days after the initial vaccine. Pfizer vaccine has just arrived this morning in PEI, and PEI will receive 1,950 doses of this vaccine. So this is a very exciting day for the province, signaling to us a hope and a light at what has proven to be a very long tunnel. PEI will be administering the initial doses of COVID-19 vaccine in this first quarter between January and March based on the recommendations of the National Advisory Committee on Immunization. And these initial groups are residents and staff in congregate living settings that provide care for seniors, adults 70 years of age and older, beginning with adults 80 years of age and older, healthcare workers, including those who work in healthcare settings, and personal support workers who work directly with patients, and adults in Indigenous communities where infection can have disproportionate consequences. In PEI, beginning tomorrow, the focus of the first doses of the vaccine will be the administration to nursing home or long-term care staff who provide direct patient care and healthcare workers involved in the COVID-19 response. This includes, but is not limited to, respiratory therapists, testing clinic staff, immunizers, cough and fever clinic staff, emergency room staff, and of course long-term care private and public frontline staff. Individuals who are scheduled to receive the vaccine will be called for an appointment. Everyone who receives the first dose must be available for the second dose in 3 weeks. As I mentioned last week, the initial shipments of the Pfizer vaccine must be administered at the location where the vaccine is delivered. In other words, initially, we cannot move this vaccine to other locations with this first shipment, but in future, it is our hope and we understand that we will be able to move this vaccine around more easily. In the coming weeks, we will continue to receive regular small shipments of the COVID-19 vaccine Pfizer product. It is our hope that other vaccines will soon be approved for use in Canada, including the Moderna product, another 2-dose vaccine. This vaccine can be transported to different sites, making it possible to administer the vaccine at locations throughout the province. Moderna is anticipated to be approved and likely to arrive in early January in this province. As soon as it does, the plan will be to take it out to long-term care facilities and community care facilities to immunize residents as quickly as possible. While it will take many months for all islanders to be immunized against COVID-19, everyone who wants to receive this vaccine will be able to, and it will be provided free of charge. Having access to a safe vaccine 9 months into this pandemic is a huge step forward in our fight against COVID-19. The 2-week circuit breaker measures that came into effect on December 7th are important in helping to break the chain of transmission of COVID-19 and PEI. These measures, as the Premier mentioned, difficult decisions, but they were put in place in response to an outbreak in the province for which there was no identified connection to out-of-province travel. Thank you to all Islanders, including the business community, who responded positively and supported the circuit breaker measures. These measures have had a positive impact, allowing us to get the outbreak under control and contain the spread of COVID-19 in our province. We did have 5 additional cases on the weekend. These cases were related to travel, but highlight that PEI remains vulnerable to the importation of COVID-19. We continue to step up our enforcement measures to ensure that individuals who are supposed to be isolating are indeed doing so. To supplement the routine daily check-in calls, additional staff will allow us to do random checks on people in self-isolation. Individuals in violation of the legal requirement to self-isolate will be fined. Despite our increased enforcement efforts, I am worried about what may be coming our way in the weeks ahead and in January, and it could be a tougher month in terms of COVID-19. My worry relates to 3 areas. First, the rising case counts and numbers of active cases in the rest of Canada is concerning, especially when we know that in PEI we're at great risk of importation of COVID-19. Secondly, the increased amount of holiday travel to PEI, including students, families, and returning workers, is a concern, as some will be arriving from COVID-19 hotspots in Canada and elsewhere. And lastly, we are coming into the holiday season, a time when our behavior and natural tendencies are to intermingle and connect with people closely, thereby increasing the risk of transmission. Although we know our individual and collective actions impact the potential spread of COVID-19, the holidays may be a time when some people let their guard down. For these reasons, I am not recommending that we go from the circuit breaker directly back to the new normal phase. Instead, I am recommending that we take a more cautious and measured approach over the next few weeks. Last week, the Premier and I spoke about the possibility of easing out of these circuit breaker measures and plugging back in slowly. So, subject to there being no substantial change to our COVID-19 situation over the next few days, I hope to announce some easing of the current measures in the form of post-circuit holiday measures effective on Friday, and they will be as follows: a slight increase in the limit for family and friend gatherings, an increase in the organized gatherings limit to allow faith gatherings and worship services to occur in slightly larger numbers beginning this weekend, reopening of in-room dining with some restrictions, fitness facilities reopening with some adjustments, recreational sports and other activities will resume in a modified format, And we are in discussion with long-term care sector regarding potential changes to the visitation guidelines. If our COVID-19 case count remains stable over the next few days, further details will be announced publicly and on the provincial website later this week to come into effect on Friday, December 18th, and I anticipate these measures will remain in effect until at least January 11th, 2021. Of course, I would love to go back to a new normal right away, but more than that, I would love us to get through this pandemic and protect our families, community, and our island. So sometimes the easiest thing to do might be to lift the circuit breaker completely and go back to new normal. That is not always the best way to keep us all safe. We know that Christmas and the holidays will be different for most families this year, with smaller gatherings focused on household members plus a small number of individuals. The holiday season can be a stressful and challenging time for many individuals, especially those who feel isolated, lonely, depressed, or who are grieving. I ask Islanders to take time to connect with their friends or neighbors who may be feeling alone, sad, or isolated over the holidays. This is the year to be creative in how we connect with family and friends. While it may not be possible to have a traditional visit, a phone call or card can be just as meaningful and uplifting as an in-person visit. Consider dropping off food or a treat to someone you know who might be lonely and unable to get together with their family and friends this holiday season. These small gestures may have a large impact on others. This holiday season, let us continue to do what Islanders do best, demonstrate our caring for one another. I do urge any Islanders who are struggling with their mental health during the holidays to please reach out for help. And the provincial COVID-19 website lists some of the supports available. And many of these supports are available by phone, online, or by text. And if you need to talk to someone right away, please call the Island Helpline at 1-800-218-2885 any time of day or night. I know children across PEI are counting the sleeps until Santa arrives, and I think there are only 10 more sleeps until Christmas. And as the little boy I mentioned earlier on asked about how many sleeps, I think we'd all like to know exactly how many sleeps until this pandemic is over and we can go back to our pre-COVID lives, but there's no definite timeline. But the arrival of a COVID-19 vaccine earlier than we anticipated is a beacon of hope for all of us, and it is a significant positive signal. As we enter this important holiday season, it is important that we do not let our guard down against COVID-19. We know that as a province, we remain vulnerable to this virus, but we know that basic public health measures are effective in fighting against COVID-19. I urge Islanders to remain vigilant over the coming weeks. Holidays will be different this year, but not forever. And I encourage everyone with smartphones to download the free National COVID Alert app. As we continue to take steps to protect ourselves and others and limit the impact of COVID-19, let us continue to be patient and kind. Thank you.
Good afternoon, everyone. Well, today is a really good day, and tomorrow will be even better. As the Premier and Dr. Morrison noted, healthcare workers will be among the first to receive the vaccine for COVID-19. I know many healthcare workers are anxiously awaiting the call to go and get their vaccine, as we all want to protect our patients, residents, and families. I'm not currently working directly with patients, so I know I'll be further down the list, but when my time comes to be offered the vaccine, I'll receive it gladly. I want to thank the QEH staff and leadership for their work to provide space and logistics support for the COVID-19 vaccine clinics this week. It's such an important moment in our fight against this virus, and thanks goes to our public health nurses again who are leading these immunization clinics. I also want to acknowledge the enormous effort over this past week that went into the thousands of people tested for COVID-19. In addition to our laboratory staff and COVID-19 clinic staff and public health, I want to thank specifically Island EMS, our IT shared services staff, and the Department of Transportation Infrastructure and Energy staff for all the work that those organizations did to ensure we could complete the testing as required, add new locations, and provide this important service. With the large number of tests done last week, we've had to send a portion of these tests off island for processing, and people whose tests were sent off island will take a few days longer for results to be returned. But we have been receiving those results back already. Our swabbing volumes are now back to a more manageable level and are being processed and completed on the island, so timelines to receive results are improving. But please be patient. Our staff in the testing clinics and laboratory are working as hard as possible to return results in a timely fashion. Our lab staff have been working diligently to process results as quickly as possible, and we've all benefited from their professionalism and dedication. Thank you to this group of health professionals. Our primary care services are back on track this week to previous levels as we reduced those services last week while those staff were reassigned to our COVID testing clinics. Thank you to everyone who's been part of this COVID response to date, including all islanders who are protecting each other and limiting the spread of the virus by following our public health guidance. Thank you.
Well, thank you both. It is good news, so let's keep building on it. So with that, I'll turn it over to some questions from our friends in the media.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr. Morrison. Bonjour à tout le monde. Dr. Morrison, on va parler beaucoup des vaccins. Je suis sûr que vous allez avoir tout un tas de questions en français, notamment sur ça plus tard. Moi, je voudrais parler avec vous du circuit breaker et des levées des restrictions qui vont donc entrer en place à partir de vendredi. Concrètement, ça veut dire que votre circuit breaker, il a fonctionné et vendredi, on revient à ce qu'on était avant le circuit breaker?
Bonjour. Alors, je pense oui, le circuit breaker, ça a fonctionné et merci à tout le monde pour nous aider avec le circuit breaker. Et on va continuer à augmenter nos efforts d'application avec les circuit breakers. Mais vendredi, c'est pas de retourner où on était avant le circuit breaker, mais de sortir du circuit breaker avec en faire attention. C'est pas tout à fait à propos du new normal, la nouvelle normale qu'on avait. On va commencer des petits pas vraiment, et parce que on veut que tout le monde soit en sécurité pendant les fêtes de Noël, et on sait qu'il y en a des gens qui retournent à l'île du Prince-Édouard. Alors, on va faire ça avec caution et un peu plus lentement.
Dr. Morrison, j'ai pas très bien compris ce que veut dire la date du 11 janvier 2021. Mais en gros, est-ce que ça veut dire que les restrictions aux frontières interprovinciales vont demeurer en place au moins jusqu'au 11 janvier 2021, et donc que toute personne qui entrera à l'île du Prince-Édouard au moins jusqu'au 11 janvier 2021 devra s'isoler pendant 14 jours?
Oui, oui, c'est ça, c'est exactement ça.
Et est-ce que vous pouvez développer pourquoi vous parlez du 11 janvier 2021?
Oui, on annonce qu'on ne va pas rester en le circuit breaker, j'espère que non, après vendredi, mais on va rester avec des mesures qui sont un peu plus relaxes, mais pas même qu'avant, jusqu'à le 11 janvier, parce qu'on veut voir et limiter la transmission de COVID pendant les fêtes et les vacances de Noël. On sait que ça peut changer si on a beaucoup de cas et de grandes transmissions communautaires, mais à ce moment, ça c'est le plan. Je sais qu'on a parlé avant j'espère d'annoncer à un moment que la période de isoler peut-être un jour va être de 14 jours jusqu'à 10 jours, mais c'est pas une décision qu'on fait seulement ici, c'est une décision nationale. Alors, peut-être en janvier, ça va arriver.
Merci beaucoup.
Gabrielle Dumont, Radio-Canada.
Bonjour, Dr. Morrison. Bonjour à tout le monde qui est présent dans cette conférence de presse. Ma question, c'est pour la Dr. Morrison en français. C'est justement, comme Julien avait mentionné, j'ai des questions au sujet des vaccins. Alors, cette première phase de vaccination commence demain et on sait que ça va fonctionner par prise des rendez-vous. Alors, est-ce que toutes les personnes qui sont censées de se faire vacciner à compter de demain, est-ce qu'elles ont déjà toutes confirmé leur rendez-vous? Est-ce qu'il y a eu des gens peut-être qui se sont refusés de se faire vacciner? Et combien de personnes vous comptez vacciner par jour ici dans la province à compter de demain?
Bonjour. Alors, on vient de recevoir à peu près 1950 vaccins aujourd'hui et commençant demain, il va y avoir les cliniques demain, jeudi, vendredi et pendant toute la journée samedi. Et puis, ces annonces de mauvais temps, on va avoir des cliniques la semaine prochaine. Mais et puis les gens... on vient juste de commencer d'avoir leur rendez-vous confirmé depuis hier et puis je sais qu'ils font des appels aujourd'hui. Alors, pas tout le monde qui vont avoir un rendez-vous appelé encore, mais ils sont en train d'en faire. C'est dans une clinique, ils peuvent faire jusqu'à 400 pendant la journée. Ils ont 5 personnes infirmières qui font les vaccins dans la clinique et puis aussi des personnes qui sont pour les aider. Et je sais, je ne fais pas tous les appels moi-même. Je sais qu'il y en a quelques-unes qui hésitent et ne veulent pas avoir le vaccin la première journée, mais la majorité des personnes sont excitées et on veut protéger eux-mêmes et leurs patients. Et je sais... quand c'est comme Marion a dit, quand c'est mon tour, j'ai hâte d'en avoir le vaccin.
Oui, j'imagine. Ma deuxième question, c'est par rapport aux effets secondaires de ce vaccin-là, parce que selon Santé Canada, comme vous le savez bien, environ 1 personne sur 10 qui va recevoir ce vaccin, ils peuvent ressentir des effets secondaires. On ne connaît pas du tout les effets secondaires à long terme de ce vaccin-là. Alors, quel sera le protocole que vous allez suivre pour gérer les cas où on aura peut-être des effets secondaires et ils peuvent apparaître et comment allez-vous faire le suivi avec ces personnes vaccinées à long terme?
OK, et puis c'est pour le COVID, le vaccin de COVID, et puis même pour tous notre vaccins ici à l'île du Prince-Édouard, c'est la loi qu'il faut reporter je ne sais pas comment vous dites ça en français, c'est APHIS en anglais, c'est Adverse Events Following Immunization en anglais. Et puis, alors, tout ça est reporté à la province, mais aussi national. Et puis, les effets secondaires plus souvent, c'est font mal au bras, et puis c'est souvent le cas pour tous les vaccins. Alors, on va en suivre, et puis avec ces nouveaux vaccins, on va suivre en particulier. On sait que à ce moment, les personnes qui sont moins de 16 ans et moins ne peuvent pas recevoir le vaccin, et les personnes qui sont enceintes et les personnes qui ont eu une réaction pratiquent un vaccin avant ne devraient pas avoir le vaccin.
Ok, parfait, merci.
Nicole Williams, CBC.
Hi, Dr. Morrison and everyone else. Forgive me, I'm wondering if you wouldn't mind just beginning by translating my colleague Julienne's questions about the January 11th date.
Okay. Hi, and I should be taking notes as I go because sometimes I can't remember all what I'm supposed to translate. But the Atlantic bubble date, I think Julian was asking me if the easing up of the restrictions that we hope will come into effect later this week would remain in effect until January 11th. And that's really to make sure that we are able to manage and control any transmission of COVID or cases of COVID-19 that we see over that holiday period, recognizing there are more people coming into the province, that holiday behavior is different, and so that is why we are going with that January 11th date. And certainly you'll see in provinces across the country that some of the restrictions they have in place are extending into a period of time in January. And I would like to point out, and I know the Premier and I have spoken about this, many places in the country are becoming more restrictive. And we're actually talking about, fortunately, trying to ease up our restrictions a little bit, which is a bit unique, I think, in the country. But those measures are, those easing up of measures, I hope will be able to stay in place over that period of time. And but it would also be the intention that anyone traveling into Prince Edward Island, as we've laid out and exists right now in New Brunswick and Newfoundland, that you would have to isolate for 14 days. The other part of another question, I'll just continue on because I know I didn't translate it, was we are still looking nationally, and I know there are discussions nationally about the possibility of reducing that period of isolation and quarantine from 14 days to 10 days. And as soon as we are able to, that would be something we would be wanting to do here in Prince Edward Island as well. But we'll wait for that national guidance.
Thank you, and I'll get to my actual first question. You spoke a little bit about the easing of restrictions on Friday, a lot of them with modifications. For people who are wondering what that means or what that looks like exactly, I'm wondering if you could give some specific examples.
Okay, and I think certainly we're looking at this and working on some of those details. But an example might be if restaurants were restaurants opening up to in-room dining, but there may be a curfew placed on the closing time of those restaurants. So that would be one example.
Okay, great. And you also spoke a lot of self-isolation and said there were now random checks into homes. I'm wondering, firstly, how many people you're expecting to travel to the province, and two, and maybe I'll ask this to both you and Premier King, I'm wondering how nervous you are about the next few weeks.
I'll start. I know there were multiple there emails about the numbers of people and confirming the numbers of people who have registered either under family connections or holiday travel into the province. I don't think I have them in front of me, although I know I did look at them earlier. So we know there are more people than we've had last month, And we also know we have new students who are arriving for the second semester at UPI or Holland College, or returning students. So that's the other group of people who are traveling in. And I think I mentioned when I was giving my remarks that I am concerned about some of this increased travel, but I also know that one of the things we've done very well in this province for many months has been around making sure people do submit an isolation plan as part of their approval process. We have something called Operation Isolation, which is really unique, again, in this country, where we have people calling people. But of course, we think that there's always a concern. It's not everyone isn't isolating the way they should be, and we are. That's why there have been additional people that have just been identified to help and do some checks on those isolation plans and physically go to those places.
And I guess I just add, Nicole, that I think we're nervous by nature and have been from the beginning of this. I think when you see time frames in which people are gathering for social reasons or celebrations in other jurisdictions, you've seen an increase from that. I mean, I think if U.S. Thanksgiving would be a most recent example where you see a spike in cases after there's a number of people who get together, because that's what we normally do at this time. So that always makes you nervous. And then, as Dr. Morrison has outlined, the return to the province for those who have left for Christmas, et cetera, is a concern for sure, because the importation of this is our biggest worry. I mean, but I think I also have a little worry similar to what Dr. Morrison has outlined, is that Christmas is the time of year when we all get together, and this year we're not going to be able to do that, and we're going to need people to make those difficult choices. I mean, I'll make it myself. I mean, if I look at my own situation, when I look at my own family with siblings, grandkids, and great-grandkids, we're about 43 or 4. And Christmas Eve has always been the big time in our house. We're not going to be able to do it this year. And that's difficult for us. It's our first year without our mom. We have to make these tough decisions. We only have to make it for this year. So I would continue to encourage Islanders to realize why they need to do this. And I know it's tough. I know this is the most social time of year, and we talk about it all the time, is that there's very few people more outgoing than Dr. Morrison and I when it comes to gatherings and stuff. But we have to just do it differently this year. So that's I think it's a worry and a concern, and I think we'll feel a lot better on January 11th if we get to a point where we've gotten through this with very limited cases.
Thank you so much.
Alison Jenkins, The Guardian.
Yes, good afternoon. Was hoping to hear a translation about the vaccine and who can't get it, and more about the side effects. I think one of the reporters had asked about the side effects and just who's not eligible for the vaccine.
Hi, Allison. So at this time, the Pfizer product, which is the one approved for use in the country, is not indicated for children under the age of 16, pregnant and breastfeeding women, people who are immunocompromised, and anyone with a prior anaphylactic reaction to a vaccine. And of course, that's for the Pfizer product. And there may be some different indications for the Moderna product and for the subsequent vaccines that will arrive in the province. I think I mentioned before there are, I think, 7 different vaccines that are in the pipeline and will be submitted to Health Canada we anticipate being submitted to Health Canada for approval. So there will be more vaccines to come, but those are the contraindications for this Pfizer product. In terms of side effects, of course, the most common side effects for really any vaccine is a really sore arm, but the side effects or reactions that people get need to be reported. It's actually the law in Prince Edward Island under the regulations that AFEs, or adverse events following immunization, are reported. They're reported provincially, and any serious ones are reported nationally. And they're really wanting this, any information about adverse events, of course, to be part of the reporting and recording requirements of this vaccine. And so we are very prepared and used to dealing with these adverse events if they arise. And but I think I said in French something similar to what Marion had said, that although it is it's not my turn yet, but when it is my turn to get the vaccine, I will be looking forward to getting it. And I think I said last week I'd get it in a heartbeat, and so I will patiently wait my turn.
Awesome. So then my next question, or my first question really, is was wondering about the booster shots and this first shipment. You say there's regular shipments coming. Will some of these first doses be saved for the boosters, or will you be depending on future shipments for those?
So, Alison, these first 1,950 doses that are coming into the province, we want to get them into as many people as quickly as possible, and we have been guaranteed a follow-up shipment next week of those, the same number of doses, and that will be then those doses that will come later this month will be what will be reserved for the second dose for these initial 1,950 people. In following doses as they start to come through January to March, when the doses do come, we will be putting half aside for the booster dose. So, for instance, if 1,000 doses comes the first week of January, 500 additional people would be vaccinated with that product.
Okay, thank you. And I was wondering, a question for Marion, roughly how many swabs had to be sent off island due to our amazing 20 to 29-year-olds who all came out to be tested?
Yeah, and we are grateful that people did come out and be tested, because that does help us understand what's going on in our community. So we're happy that people came out to be tested. I don't have the exact numbers, Allison, but it was over 600 that we sent out overall, and we have started to receive some of those results back already.
Super, thank you very much.
Thought I might add that in the last week, 58% of the tests that were done were in that 20 to 29-year-old age group, just to give us a sense.
Oh, thank you.
Louise Martin, CBC.
Hello, and good afternoon to all three of you today. Thanks for taking our questions. You addressed a little bit of my question just previously there with the holding back of vaccines. Some provinces are doing that, others are not. So I just want to understand why PEI would not be holding back sort of the second dose, only about 50% efficacy after the first dose. And I was wondering if you're worried about Islanders not getting it. Yesterday in a national story that CBC ran, we heard the federal government say details of the next shipment have actually not been confirmed. So can you just go into the decision behind that?
Well, there have been a lot of back and forth with the company and national logistics. So it is only this first shipment that we're getting the 1950. I know that the next dose is guaranteed, and then. And that's why we can give the 1950 and start doing that. But after that, in those subsequent shipments, we want to make sure that there's no issues with delay, production, shipping, weather. And so that's why after these early shipments that arrive today and will arrive next week, we will be keeping half aside for the booster dose.
so PEI has been able to confirm a shipment next week for sure.
Well, I mean, I think we have talked with our colleagues too. We've had back and forth discussions. I think you absolutely identify where there was some concern. Initially, we thought we would have to hold them back, but we were given the go-ahead that we could use them. And you have to remember, our doses are relatively smaller numbers than some of the bigger provinces too that would be bringing them in.
Thank you.
Okay.
This question is actually both for yourself and the Premier. If you can just talk about schools. We've had this 2-week remote learning for 4 high schools in the Charlottetown area. Is there any sense that will continue after the Christmas break? And is there any sense of whether you will extend the Christmas break? I know Nova Scotia recently decided to make it a longer week, an extra week, to just ensure after the holiday gatherings there was a bit of leeway there.
Sure. I think in terms of the online component, those would be really education's decisions, and in terms of what they would move to after the holidays. But we certainly have no indication at this point of transmission within schools, and it's we've always said that being in class and in school is really good for students, and so I think that's always been the case. We've talked about it for months, that a goal of trying to keep community transmission low or keep that at bay is, if we can do that, we can really have schools function in person learning in a different way. So I think these are discussions that we, of course, will have, but at this point in time, I've not had that discussion with education.
Yeah, and the only thing I would add to that, Louise, would be the intention to resume in-person school for everybody at the end of the designated break. I think anything that we would do in terms of changing that would need to be in consultation with the Public Health Office and based on the epidemiology and how things are working here. But that's sort of been the process that we've been working on from the very beginning. We keep an eye on what other jurisdictions do for sure, but those decisions we would make based on what things are like here in Prince Edward Island, and obviously if there's a spike in cases and those cases are worrisome, we would then consult with education and work on that. But I think right now it would be our intention to resume school at the end of the break as it has been designated.
Appreciate that. Thanks so much.
Thank you.
Rachel Collier, The Graphic.
Hi. I guess you mentioned earlier there that there'll be random checks in on those who are self-isolating. I'm wondering if you could maybe just kind of explain like how many random checks will be performed in comparison to how many people are self-isolating, like how frequent those checks might be expected.
So we would have, again, I'm not sure I have the isolation numbers in front of me, but we have well over 1,200, I believe, in isolation at the moment. And it will depend on the week how many people are coming in that may be in isolation. So the list of people in isolation, I think it will be a random selection of additional door knocks. We know we already send enforcement out if Operation Isolation is concerned that someone is not following isolation plans. So this would be one additional measure to make sure that we're not missing people. And also a reminder that at any time someone might get a knock on the door, and make sure that they're isolating the way they indicated when they came in the province they would do. So I don't have a number, but that is something that we think is important over the next few weeks.
Okay, so you don't have a number of like how many checks per week would be performed or anything like that at this point?
Yeah, once we do them, we'll be happy to share.
Okay, And I guess the other thing was, do you have any indication of like uptake among long-term care workers of just how many people are looking to get vaccines? I don't know if you might have done any surveys or anything like that, just to know how many might be looking to get a vaccine.
Well, and I'll see if Marion may be able to speak to this too, but I know that one of our large long-term care facilities actually surveyed their staff last week, and it was overwhelmingly positive that they wanted to get the vaccine. And so those are certainly some indications that there's a real desire for long-term care staff, for instance, to protect themselves and a very vulnerable population that they are looking after. I don't know if you want to add to that.
Yeah, I don't have the specific numbers, Rachel, or anything about that, but as I mentioned earlier, we have lots of healthcare workers and in various care areas, even outside long-term care, calling and submitting forward their interest in receiving the vaccine to protect themselves and their patients or their clients. So there's lots of people waiting in line to get this. So we do hope we can have this run smoothly and get it out to people as quickly as it arrives.
Okay, thanks.
Laurent Rigaud, La Voix chrétienne.
Bonjour à tout le monde. Bonjour, Dr Morrison. J'avais une question sur le vaccin de Moderna. Vous avez dit qu'il pourra être déplacé et donc il pourra permettre de vacciner les pensionnaires dans les centres de soins longue durée. Est-ce que ça veut dire que les pensionnaires dans les centres de soins longue durée ne seront pas vaccinés avant l'arrivée du vaccin Moderna? Est-ce que ça signifie que pour chaque vaccin, il y a une catégorie de personnes qui est ciblée?
Je m'excuse, j'ai pas compris la dernière partie de votre question.
C'était juste pour savoir si pour chaque vaccin, chaque type de vaccin, il y aura un type de population ciblée. Par exemple, Moderna, les personnes dans les centres de soins longue durée, et les suivants permettront de vacciner, par exemple, les jeunes ou ce genre de choses.
C'est une bonne question, mais c'est pas vraiment d'un groupe un vaccin en particulier, mais il faut, si vous commencez avec un vaccin, si vous avez Moderna, pour commencer, votre booster doit être Moderna. Pour nous, c'est juste pour, on parle de Moderna si ça vient d'être approuvé, si c'est approuvé par Santé Canada. C'est un vaccin c'est plus facile de transporter le vaccin aux résidences des places de longue durée. Mais c'est parce que le Pfizer qui vient d'arriver, il faut donner ses premiers vaccins sur location. Alors, c'est juste des logistiques qui... mais on veut quand même avoir les vaccins pour les plus âgés. Mais ça va, si on peut transporter le Pfizer product, on peut commencer aussi de faire les vaccins pour le même groupe de personnes. C'est vraiment d'être les deux vaccins, le Pfizer et le Moderna qui est, on espère, doit être approuvés bientôt, sont les deux premiers, mais ne sont pas seulement pour certains groupes, c'est vraiment identifier les 4 groupes de priorité vraiment, et on va essayer d'en faire le plus tôt que possible.
Et juste pour conclure, vous avez dit que vous avez parlé à un garçon qui vous a demandé combien de nuits encore jusqu'à la fin de cette crise. Alors, je vous pose la question différemment. Combien de mardis encore jusqu'à ce que tout ça soit fini?
Le Premier ministre et moi, on vient de discuter ça en descendant ici. On sait... je ne sais pas, mais j'espère par l'été que je ne serai pas ici. Mais on va voir.
Merci.
Well, thank you very much, everybody. I believe that brings an end to our our news conference today, and we look forward to just all good news in the days ahead. So, thank you.